Good morning, everybody, and thank you for being here. I am joined by a very esteemed group of people. We'll start up with Shari from the Deaf Action Center. We have with us today Dr. Chantel Hebert-McGee from Louisiana Department of Health. She is our Region 1 Medical Director. Dr. Mark Klein is the Physician-in-Chief and Chief Academic Officer for LCMC Health Pediatric Children's Hospital. Dr. Jeffrey Elder, the Medical Director for Emergency Management at LCMC Health, and Dr. Evans Laborde, the Medical Director of Global Health and Medical Director of Public Health at Ochsner, and our Coroner for Jefferson Parish, Dr. Jerry Satanovich, as well as Mayor Robert Bilyatz joining us this morning. We are in Westwego here at the Ilario Center, so thank you for joining us today. So we are certainly in the midst of our fourth surge in Jefferson Parish, have been in this very unfortunate position for our community for the past month. We are averaging about 500 cases a day. For perspective, when we go low in our parish, it's 30 to 60 cases a day. We're at 500 cases a day. So that is the situation we find ourselves in with a positivity rate of 17%. This is the highest cases we've seen since the pandemic has started. This is the worst time that we've seen, and hospitalizations are at an all-time high with COVID. And that's why we have our medical professionals here from our major hospital systems to tell you firsthand what is going on at their workplace at our local hospitals. And so you can see what they're seeing, you can understand what they're seeing. Our region, Region 1, it's a 4-parish region, has 593 COVID patients in the hospital. 245 of those people are in the ICU, and 67 are on ventilators. So our teams have been working very hard to help our medical community in any way we can, and we've done so from the very beginning. I know they're tired and exhausted, and anything our resources can do to try to just alleviate some of that pressure off of our hospital systems, we're going to do that. So today we're here to announce that our COVID vaccination and testing site, one-stop shop to get vaccines and testing, and our partners with the Louisiana National Guard and Louisiana Department of Health will be returning to the Ilario Center starting Monday, August 16th, right here. We're going to come back to testing here. We've hosted free community testing. It's something that I'm personally very proud of. We have always had free community testing since the very start of this pandemic, March of last year. We were one of the very federal pilot sites to have free community testing, and we have had it every day since the pandemic started. 2 months ago, when things were better for us and we were trying to get back to speed, bring events back to Ilario Center, we moved the testing site to Harold McDonald Park to scale it down. At that time, we were only seeing about 15 to 20 people a day, so we moved it right across West Bank Expressway. But more recently, obviously, with this surge, we're seeing 250 to 300 people a day at that site, and that little site cannot house the amount of demand that the community has for testing right now. So we're moving it back here to Ilario Center. This is going to be on Monday. So this is going to be a drive-through testing site and a walk-up vaccination site. Monday through Friday, 8 a.m. to 4 p.m., and Saturday, 8 a.m. to 2 p.m. And the vaccinations that will be offered here will be Pfizer and Johnson & Johnson for anyone over the age of 12. All tests and vaccinations are free of charge, and you can register online for the testing at jeffparish.net. So we're also working hard with the Ilario Center to continue their scheduled operations as planned. In addition to that site, Ochsner is going to be offering free COVID testing at Celebration Church in Kenner every Monday and Tuesday from 9 to 1. And West Jefferson Medical Center, LCMC, is providing drive-through testing Monday through Friday at 10 a.m. to 5 p.m. Ochsner's also at Lakeside Mall every day from 11 to 6:30, at Oakwood Mall on Thursday through Saturday, 11 to 6:30, and of course at the airport by the baggage claim every day from 8:30 to 5. And we will be announcing more sites in the next few days. We're working on those new testing and vaccination sites. Again, this is to just help relieve some of the pressure, the incredible pressure on our hospital systems. We know that the vast majority of these cases are occurring in our younger populations. I'm going to let our medical professionals tell you we're actually getting additional resources from the federal government here in our community to help us in this very, very difficult situation. The good news for us in Jefferson Parish is that the vaccination rates are increasing, and we're seeing more people getting vaccinated, most of those under the age of 30. We're seeing higher rates of vaccination. So 72% of our eligible population, and you take the 12s and under, they're not eligible, so you take that out of the equation, 72% of the eligible population has received at least the first dose of the vaccine. That is 23,000 more vaccines in just this parish in the last 3 weeks. So that is the good news. I'll tell you, our medical community is concerned. I sat in on an update from LCMC yesterday. I sat in on an update with Ochsner. They're concerned also, of course, with what's in front of them, this terrible COVID surge, but also just what happens to our overall health as their need to address COVID is pushing back routine services, whether it's heart, all kind of internal issues that later will become more immediate. So if you don't think this disease is affecting you, it is, in the sense that the resources that are overwhelmingly having to deal with COVID and overall our health is going to suffer on other issues. Tests that could be done now to reveal something and that may be more preventable are delayed, and that's affecting every single one of us. There's no doubt that it affects you. So nobody is getting away from being affected by COVID. If you've never had it, if you whatever, you're going to stay. Nobody is not being affected by this. Let's show our respect for these folks behind us and the people they work with. Let's do what we can for the mitigation measures. Let's wear masks. Let's socially distance. Let's be smart about the activities that we do. This is the way that our economy moves forward, that kids get back to school, that we are able to live with this horrible virus doing something as simple as wearing a mask. I will never understand why this is such a big deal, given the situation we're in where our hospitals are bursting at the seams. I will never get that, why this little thing over your face is such a big deal to people. It's not. It's not. This is a small mitigation measure that we can do. If you don't want to protect yourself, we got to at least respect these folks behind us who are working the fourth time. They're tired. Can you imagine? Federal government is having to send us additional resources. So this is our way to have to live with this virus until we can finally put this thing to bed. So please, let's show respect for us, for our medical community. Please think about getting vaccinated if you haven't done it already. You're going to hear what's going on with our children. I'm a parent. What we do, what's ingrained in us is to protect our children. It is a very natural instinct that we have. I'm a mom. Please consider getting vaccinated for your child who is not eligible to get vaccinated if they're 12 or under, So this is not, we're in hurricane season, and it's going to be an active 3 weeks for hurricane. I will say that we have to look at it. Luckily, the tropical storm right now is not heading our way, but it will be an active season. We can't control that. We just have to brace for what Mother Nature sends our way, and we just try to proactively brace for that. This we can control. Our actions control how long this surge is going on, how high we go, how long we're into this. Our very actions individually control that. So I'm begging you, please, let's get on board with what our community is asking you to do for the sake of all of us, okay? Please, covid.jeffparish.net for any information you need about testing, vaccinations. We're going to be working with the Blood Center to host blood drives next week, so I encourage you at our playgrounds, I encourage you to look at jeffparish.net for the blood drives. That's something, many of you want to do something, don't know what to do, let's consider giving blood, okay? So with that, I will get off and let the next speaker, we're honored to have with us, Region 1 Medical Director, Dr. Chantel Hebert-McGee from the Louisiana Department of Public Health, to give an update on what's going on in our region, in Region 1.
Thank you, Parish President Lee Sheng. Thank you, Jefferson Parish and the Alario Center for opening up this testing site once again. Never would I imagine that I will be speaking to you today about mass vaccination and testing sites I thought we were beyond this. I thought that this would have never happened given this fourth surge, but nevertheless, I am here. So where do I start? The CDC has a threshold for what they consider to be high transmission. That threshold is 100 COVID cases per 100,000 per week. Right now, we're at 100 cases per 100,000 per day, not per week. That means we are well beyond the threshold for high transmission. As Parish President Lee Sheng said, Jefferson Parish is at 17.8% for positive cases, or for the percent positivity for transmission. And anything over 10% is considered to be extremely high, extremely contagious, and high transmissibility. And so I ask, how is that affecting where we are right now, our hospital systems? And so they are at the highest capacity. As mentioned, we are asking for federal support as well as volunteers to assist with the efforts, because our hospital systems are currently crumbling under the weight of COVID-19. We understand that nurses are being redeployed from clinics and vaccination sites to actually serve in CCUs and ICUs, because 90% of COVID patients who are currently hospitalized are unvaccinated. We know that our doctors are no longer serving in the clinics. They're no longer doing elective procedures. They're not putting in pacemakers or performing transplants, because they're needed to help with the burden of COVID-19. And honestly, this could have been avoided. So I want to say that healthcare is not a luxury. Let me repeat, healthcare is not a luxury. So for people who need to have procedures done, for people who are looking for quality care and access right now, it may not happen. You may not get the service that you are accustomed to. Healthcare systems are compromised. Additionally, I think we must consider that vaccinations are no longer a luxury, right? There are many people who have been waiting for full FDA approval, saying, I'm going to wait until it's fully approved. Well, right now we have over 2 million people in the state of Louisiana who have been vaccinated, and only 8 have had a severe allergic reaction requiring hospitalization, and none have died. Earlier this week, we had nearly 100 people who died from COVID-19 in one day. So how can you compare the life-saving benefits of the vaccine to being on a ventilator, being intubated, and possibly losing your life because you choose not to get vaccinated? What else is not a luxury? Taking our children for granted. We realize that kids under the age of 12 are not eligible for vaccines yet. So how can you be dismissive of mandatory mask mandates that require for people to be masked in public indoor spaces? How can you be dismissive of the elderly, who we know 85% have been vaccinated, but unfortunately their immune systems may still be compromised? And so if you're not wearing your mask, if you're not socially distancing, if you are not vaccinated, this may lead to individuals who have taken every precaution finding themselves, unfortunately, hospitalized. So I want to leave you with this. Currently, we have over 70 schools in Jefferson Parish that are enrolled in the K-12 testing program, meaning that children can be tested weekly to ensure that they are not positive. It will help to curtail transmission. It will lead to earlier diagnoses. We know that kids are getting sicker with this Delta variant. We know that people are more likely to be hospitalized, people are more likely to die. So therefore, if we can get early testing and early detection done, it would allow for them to be able to get monoclonal antibodies in order to prevent them from being hospitalized. And this is offered free. All that is required is parental consent. So therefore, I'm asking that you don't take anything as a luxury, because life should not be taken for granted. Thank you.
Thank you so much, Dr. Amer McGee. Next, we have Dr. Mark Klein, the Physician-in-Chief and Chief Academic Officer for LCMC Health Pediatric at Children's Hospital.
Well, I'd like to just say that I would echo the words that you've heard already from the parish president and from the health department representative. This Delta variant of COVID-19, I think, is unlike anything we've ever seen before. I've described it as a nightmare for infectious disease doctors and epidemiologists. I've also made the statement that it's not your grandfather's COVID-19. This is not the epidemic we were dealing with even a year ago. This is an epidemic of unvaccinated people who are largely young and many of whom are healthy, who do not have underlying conditions. So if you're not vaccinated, you're at risk. And it's been said by others that everyone who is unvaccinated at this point in time will either eventually take a vaccine or will acquire COVID-19. And we're seeing that play out in real time across Louisiana and across this region, of course. Specifically where children are concerned, there are nearly 100,000 new cases of COVID-19 reported in children every day now. This is quite different than 2020, when only about 6% of COVID-19 cases nationally occurred among children. So 100,000 new cases a day across the United States. And the hospitalizations for children with COVID-19 are 4 times greater today than they were just 30 days ago. Louisiana has a particular problem because of the low adult COVID-19 vaccination rate. Just 37 or 38% of adults in Louisiana are vaccinated fully against COVID-19. If you look specifically at adolescents between 12 and 17 years of age, that rate is about 13% compared to a national figure of between 30 and 35%. So we've got a lot of work to do here in Louisiana. And because of our low vaccination rates, as you've heard, children are being affected very seriously. I want to talk specifically now about Children's Hospital New Orleans. We have a number of ambulatory or outpatient testing sites across the region. 30 days ago, the COVID-19 positivity rate at those sites in aggregate was 1%. 2 weeks ago, that had risen to 7%. Today, that rate is 25%, which is the highest we have ever seen. What that's telling us is that there is an enormous amount of community transmission going on. These children are acquiring the infection from unvaccinated adults in their environment, sometimes from their parents, but it could be an aunt or an uncle or some other adult that they come in contact with. This particular variant of the virus is so contagious that the contact can be far more casual than we've seen in the past. We have more children hospitalized for COVID-19 at Children's Hospital New Orleans than ever before. In fact, we're well over twice the number of children that we ever had in the hospital on any given day in 2020. And as of this morning, there are 6 children in the intensive care units with COVID-19, 2 on ventilators, 1 on ECMO. ECMO is where the blood is circulated outside of the body to support a failing heart and lungs. It's really a last-ditch measure to save the life of a child. This particular child is just 23 months old. Many of the children we're seeing, in fact, most are under 2 years of age. And as has been pointed out, children under 12 are not eligible for vaccination just yet. We're hoping that the FDA very soon will give emergency use authorization to vaccines for children at least 5 to 11 years of age, but that remains to be seen. So across the United States, the only group of individuals who is 100% unvaccinated is children from birth to 12 years of age. And what we can do to protect them is wear masks. Masks need to be mandatory in schools for all children. Children as young as 2 can learn to wear a mask. They just treat it as another item of clothing. It can even be made into a game for young children. They can be playful with a mask. But certainly children 5 and up, those children were included in the governor's mandate that was issued Monday before last. Children 5 and up certainly can wear a mask, and a mask will help keep them from becoming infected. The other tried and true mitigation measures we have, having to do with ventilation and air filtration, social distancing, good hand washing, all of those things should still be in effect. But what's ultimately going to get us out of this pickle that we find ourselves in is vaccination. We've got to get that vaccination up. Unless we want to see this Delta surge continue, unless we want to suffer through other surges in the future with variants of the virus that might be even more virulent than this one and might produce even more disease and death, we've got to vaccinate. There's no ifs, ands, or buts about that. And so for people who have been on the fence and who have been hesitant to be vaccinated, if you're not willing to do it for your own health or for the health of your partner or your family members, let's do it for the young children in our community who really don't have a choice. They don't have access to a vaccine. Their only hope really is to be cocooned or surrounded by adults who've done the right thing, who've masked up, and who've vaccinated to protect themselves and their community and the most vulnerable members of the community, which are these young children who are falling ill today. I'll close by saying that we're very grateful for the assistance that we have received from HHS, these disaster medical assistance teams that you've heard about. We had 14 health professionals arrive at the first of the week. They're now working in our emergency department and our intensive care units at Children's New Orleans. We had 10 more individuals arrive yesterday. They're from across the United States. They're here to volunteer and help in any way that they can. Staffing really has become rate limiting for us. We were understaffed because of the loss of health professionals, not through death, thankfully, but through resignation and retirement over the past year. So we were already very thin. But we have an additional 60 staff members who are out today with COVID-19. So we really needed the help, and we've gotten it in the form of this DMAT team that has arrived, and we're grateful to Health and Human Services for helping us out with that. I'll stop right there, and thanks very much to the parish president for the opportunity to be here today.
Thank you so much, Dr. Klein. Our next speaker is the Medical Director for Emergency Management at LCMC Health, Dr. Jeffrey Elder, and you saw him at our last press conference.
Good morning. I'd like to speak a little bit about what we see in our hospitals today. And, you know, our hospitals right now in Jefferson Parish, across the South Shore, in Louisiana, across the Southeast are full. Our medical surge beds or our floor beds are full. Our ICUs are full. Our emergency departments have ICU patients that don't have a bed upstairs. They have medical surge patients that don't have a bed upstairs every day. And this is not just an isolated case of one hospital, one city, one region. This is across the state and across the southeastern United States. And we are seeing this because we are seeing more and more COVID patients in our hospitals. A vast majority are unvaccinated, so 88, 90% unvaccinated. And we aren't able to do some of the other things that we do every day with our patients. So some of those things like open heart surgeries, transplants, things that can be scheduled, we are unable to do because we have these critically ill COVID patients in our hospitals using our resources. And so I think what people need to realize, this is not just the COVID positive patients, that are at risk here. It's all of us. Because now we don't have the ability to move patients from hospital to hospital for specialty services. Every day we have lists of patients that they're trying to move from smaller hospitals, smaller ERs, to specialty centers or tertiary care, large hospitals for specialty care. And because of the bed shortage across the state and the Southeast, we can't do that. And so people wait in other facilities that can't give them the full care that they need because of the patients that are in the hospital. And there are ways we can get through this. We've done it before. We saw these spikes earlier. This is as bad as we've seen. And what we need people to do now is what everybody's going to talk about here today. Today, it's mask up. Mask, keep the spread down in the community. It's get vaccinated if you haven't been vaccinated. If you vaccinate today with your first dose of a Pfizer vaccine, it's going to be 5 weeks until you're fully vaccinated and protected against COVID. But there is no time like the present to start. So if you're not vaccinated, get vaccinated. That will keep you from ending up in the hospital, weeks from now if you're exposed to COVID. And so what I want to just close with is that this is a problem that we are not only seeing locally, we are seeing across the state, across the Southeast, and as of now, it's not slowing down. We have close to 3,000 COVID patients in our hospitals today in Louisiana. And if we want to stop this, we have to do these really simple measures like masking to get us through this. Thank you.
Thank you so much, Dr. Elder. The next doctor we'll have is no stranger to us in Jefferson Parish, Medical Director of Global Health and Medical Director of Public Health at Ochsner Health, Dr. Evans Laborde.
Good morning, everyone, and thank you, Vice President Cynthia Chang, and all the speakers preceding me. I guess I'll start by saying, really on a positive note, very thrilled actually that Jefferson Parish, once again, the leadership that the Parish President always shown is taking the lead in reopening the Ilario Center, as she mentioned, for drive-through testing and vaccinations. It's an important site right here on the West Bank, so I think that's critically important. But more importantly, to echo what most of the speakers before me had actually said, I'm here primarily to plead, to make a plea, and to plead with you, to everyone, if you have not yet gotten vaccinated against COVID-19, I implore you to please do so as soon as possible. Our situation is dire from my perspective. And it's one that's painful because in some ways, from a global health perspective, it was both predictable and preventable. And we have to own that. Each and every one of us have to collectively own that. And the only way that we can get ourselves out of this situation, both locally and globally, is if we do it together as a community, as one. That's the only solution. That's the only way out of this, is us taking collective action together. So if you've already taken the shot, I sincerely thank you, and I applaud you for having taken that social and personal responsibility to do that. As everybody else before me has said, vaccination is our best way out of this pandemic, so that we can all return really to the activities that we enjoy without fear of becoming sick or infecting others. It's the only way we can manage this highly contagious Delta variant and truly bring Jefferson Parish, our communities, and Louisiana back. So again, please encourage your family members, your friends, colleagues, community members to get vaccinated. We all know, unfortunately, there's a lot of misinformation and disinformation out there. So I implore those of you who've vaccinated yourselves, who've taken the action, tell your story. Share the facts, share the truth, be a voice. All 3 vaccines are safe and they're effective at preventing serious illness, hospitalization, and death. That's the point. Right now, as everybody else has stated, we're in the 4th surge, and there's no sign of it slowing down at this point. There just really isn't. The Delta variant, as you all know, is more contagious than anything we've seen before along this pandemic. So we have to increase our vaccination rates, and we have to do that efficiently, and we have to do it quickly because it's a race. I mean, we're essentially racing against this Delta variant. And we have 3 safe and highly effective vaccines at our disposal. It's not as if we're powerless. Vaccination, along with the strict adherence to masking and social distancing, will help us get through these difficult times. Again, as Dr. Elder and others have mentioned, our hospitals, they're stretched, and they're stretched to the limit. For example, at Ochsner right now, from a staffing perspective, 500 of our staff across the state are actually out due to COVID quarantine. Imagine that. So our own people are actually unable to provide the care that we need to provide you. But fortunately, we're getting support from the federal government and the state government through the DMAT program, as Dr. Klein mentioned, so that we can actually provide some support in North Louisiana, Lafayette, and Greater New Orleans. And we'll continue to work with them to get additional help for hospital capacity and also provide us the opportunity to provide the monoclonal antibody treatment support that Dr. Helder actually mentioned. So as of yesterday, to give you some specifics and put this in perspective, as many of us have done, Oxnard had 1,063 patients hospitalized for COVID-19. 1,063. 946 of them, that's nearly 90%, had not yet been fully vaccinated. So they're essentially preventable hospitalizations. They did not need to be in the hospital if they had actually gotten vaccinated. It's really quite that simple. Our hospital is full. So as the parish president mentioned, it doesn't only impact the people in the hospital, it's been hard on our staff. And additionally, we've actually had to turn down 175 transfers over the past 7 days because we have a referral center. We're a tertiary quaternary facility. So other facilities with patients needing a higher level of care, of specialty care, that's not available in their region or at their local hospital, they depend on us. And we're unable to do that, primarily because of a preventable disease that we have to deal with. So we typically accept, as you all probably know, up to 50 transfers per day. And we're not able to do that. So we've also, as Dr. Elder mentioned, we have to postpone the number of elective procedures and cases. So people who need care are not able to do it. We've had to postpone a transplant surgery. We've had to cancel surgeries, cancel hip replacement surgeries, cancel preventive screenings, cancer screenings, and all those impact people beyond you. So with this surge, again, as Dr. Klein mentioned, we're seeing younger and sicker patients. The average age of the patients so far in this surge is around 55, and that's down from 65 years old during the third surge over the holidays. So since the beginning of this week, at our locations, we've actually administered nearly 16,000 COVID tests, and with a positivity rate of 19.6%. That's nearly 31%, and out of those, nearly 31% of those tests were for patients ages 0 to 19. And the positivity rate for them was actually even higher at 23.4%. So, and again, our urgent care and emergency departments, like I need to construct this for the people to understand, are overflowing with people seeking COVID tests and seeking care. That's why, again, I applaud the parish president for opening this site here at the Ilario Center, both for testing and for vaccination. When people seeking COVID tests overwhelm our urgent care centers, as Dr. Satanovich knows, our emergency departments, as Dr. Elder referred to, it can impact care that we're able to provide to both COVID and non-COVID patients who come to our ED, who come to our urgent care for a different illness or injury that's time sensitive and we can't provide it. That's frustrating, that's hurtful to us. So to give you an idea of the volume that we're actually saying, because I think the numbers matter, that we're seeing in our urgent care centers, we've treated more than 38,000 patients in our urgent care centers in July, for the month of July. And we're on track to treat more than 45,000 patients this month. And if you can contrast that to what it was pre-COVID, we were actually treating around 14,500 urgent care patients per month. And you can imagine the stress that puts on the system and on our patient and on our staff. So again, I'm asking anybody who suspects at this point in time that they may actually been exposed to COVID-19 because they're so highly contagious and transmissible, but whether they're asymptomatic or have mild symptoms, if you've been exposed, please seek out the multitude of community testing sites that Parish President alluded to and that we're going to have here as well at the Ilario Center so that we can continue to be free at the EDs and at the urgent care centers to treat the patients with the multiple conditions that they come to us to get treatment for in a timely manner. Again, I'm going to end by saying Oxnard, the parish president, the state, we remain unwavering in our commitment to administer vaccines, to do that quickly, to do it equitably. Here in Jefferson Parish and across the state, we're committed to doing all that we can. But at the end of the day, I want to convey to you that as physicians, as healthcare professionals, there's no question about it that we're resilient. But I'm going to tell you, as Dr. Elder would tell you as well, we're not unbreakable. We're human, just like you. Many of us are overwhelmed, we're exhausted emotionally, physically, and mentally, and we need your help. We need your help to flatten the curve, stop the spread of the virus, bring this pandemic under control once and for all, get vaccinated, do the right thing, wear your mask, socially distant, do what you need, you know that you need to do to get this thing taken care of so we can move forward. Thank you.
Thank you so much, Dr. Laborde. Next, we're going to have our Jefferson Parish Coroner, Dr. Jerry Satanovich.
Good morning, everybody. So after all that bad news, they bring the coroner up. I'll tell you, with COVID, the trend, what we see is it starts off with people getting tested, then you get people going to clinics, then hospitalizations, and then ultimately deaths. So, the hospitalizations follow the positivity spikes by a week or two. The deaths follow the hospitalization spikes by a week or two. So it's not surprising that we're seeing a lot more deaths in Jefferson Parish. To give you some context, though, in January, February, we had just under 97 deaths in January, 49 in February. Then we started doing pretty well. We went down to 16, to 10, to 3, and in June we only had 4 deaths. So we were doing quite well. In July, and almost all in the last week and a half of July, we had 16 deaths. And in the first 11 days of this month, we've had 21 deaths. So we're starting to see our death curve go up. Some observations about that. The good news is, at the moment, it's not as high as our death curve in December and January, and definitely not as high as our death curve last year. But every single one of those deaths is somebody's loved one. People dying are getting younger. Okay, that's just the truth. And I will say a lot of them still continue to have comorbidities, but some don't. In Jefferson Parish, it seems like we have kind of 2 areas where we have more deaths than the rest of the parish, and that's Marrero and Kenner. Most of the people dying, I think 60% are male. Most of the patients have comorbidities, but some are completely healthy people. And last but definitely not least, the overwhelming majority, over 95% of our deaths so far, have been people who are not vaccinated. And that's not an opinion, that's just a fact. I'd like to just actually give a little public service announcement on behalf of our friends at LCMC and Ochsner and at Tulane and every other healthcare provider. If anybody out there is looking for work, they're hiring. They're so unbelievably short-staffed at every level. You don't have to be a healthcare professional to go work in healthcare. And trust me, our community needs people working in healthcare. Doctors, nurses, medical assistants, paramedics, nursing aides, janitorial, maintenance, registration, every level of healthcare, not just patient-facing, but in the other direction as well, needs help. They're unbelievably short-staffed. Then on top of being short-staffed, these healthcare providers are getting multiple employees out every week with COVID. So that's really putting a strain. And I know a lot of the folks that are working on those front lines, and they're stretched so thin, both from a professional and a personal perspective. So just like the last time I spoke, I'll tell you, if you know somebody that's on the front line, working in paramedic, a medical assistant, urgent care, ER, no matter what it is, a COVID unit, please thank them, encourage them to keep doing what they're doing, because it's amazing. Thank you very much.
Thank you so much, Dr. Satanovich. And I just want to share, I was in 3 conversations this past week with people who have lost loved ones. We're sending a lot of data to you, but 957 families in Jefferson Parish are forever changed and have grieved because they lost a loved one. And those 3 conversations I had this week, they all lost members of their family, and they were able to convince people who are on the fence to get vaccinated. So sometimes those are the best messengers of being able to talk to someone about the ravages of this disease and what was taken from them. at too early of an age. So sometimes somebody like me, an elected official or a doctor that you don't know, is not in your personal life, isn't able to get through with that message. But certainly, my one friend texted me, she convinced 8 people to get a vaccine because she lost her father. And I know she was probably very passionate in her plea because it affected her life greatly. So don't underestimate the power that you have to care for someone and to get them the education that they need about this very safe vaccine. The scientists have done an incredible thing for us, and we don't have to have these death rates, and we don't have to have these hospitalizations that we're seeing. So with that, I'll open it to any questions that you may have for any of our medical professionals. Go ahead.
Dr. McGee, earlier you referenced that the statewide hospital systems are crumbling. And obviously we've heard it from everyone here that the hospitals are strained. Can you talk a little bit more about that statewide and what you all have seen across the state with this? Or the region, rather?
So, from a regional stance as well as from a state stance, we know that the burden has been tremendous. As mentioned by all of our speakers, units have been closed. They've opened up new units. Unfortunately, there's not enough staff to actually support those units. As mentioned by Dr. Laborde as well as Dr. Elders, we have several members who have also contracted COVID. So either they are isolating or quarantining because of close contacts, and that has had a tremendous burden. It has caused us to have to reach out to volunteers. So we have LAVA volunteers who are typically retired doctors and nurses who choose to come back and support in times of crisis. And we try not to employ or deploy those workers except in cases of emergency, typically for hurricanes or emergency preparedness. But unfortunately now, because we're in this fourth surge and the Delta strain or the Delta variant has been so tremendously devastating to our system, we've had to reach out to LAVA as well as the federal government for additional support. We are still awaiting more support. The National Guard has been outfitting a lot of our testing sites as well as vaccination sites. Unfortunately, they are also stretched thin. They have orders. Those orders change. So we realize, as Dr. Laborde said, that we are human. Our workforce is also frail, and unfortunately, with people not taking this particular variant serious and not responding in the most appropriate manners, being social distancing, wearing masks, getting vaccinated, it has led to us having a very protracted course, something that could have been avoided. If we compare our rates to other states, we recognize that Louisiana is still very low when it comes to percentage of individuals who are vaccinated, and we expected this. This was foreboding message. We knew that if people were not vaccinated, because how contagious the Delta variant is, that we were going to be in a situation that we're in now. So it truly is a plea, it is a cry for help, asking everyone to be accountable and recognize that their decisions not only impact themselves, but it also impacts the entire community.
President, thank you for giving clarity on this. So with that being said, how will the testing site here at the Alario Center be staffed? Will that be able to?
We have had, for our testing center from the beginning, we usually provide the property and we have help with our own staff, but it's the Louisiana National Guard, and we can't thank them enough. I mean, they have had, all of them don't live here. They're away from their families this whole entire time. So they're out there in their uniforms in the hot heat, and they're the ones that are giving the vaccines or doing the testing. So it's the Louisiana National Guard that's partnered with us. Yes. Anybody else?
Can any of the hospital officials kind of talk to us? Are you all doing infusions at the hospital there? And did you would like to see more? Maybe we can just talk about that.
Yeah, so absolutely. So for those patients that test positive for COVID, or for a select set that have high-risk conditions who maybe aren't vaccinated and are exposed, we do have monoclonal antibody infusions that are available. They're available for us at all of our adult hospitals. I know Ochsner as well has a tremendous capacity for the infusions. And so that is available for those that are testing positive, who meet certain criteria and don't require hospitalization. And the goal there is to keep people from getting sicker and then ending up in the hospital. So we hope to catch them early. I know for us, you can go to lcmchealth.org or go to our nurse hotline. They can point you in the right direction for that, as well as obviously through Ochsner. Also has, I'm sure if you go to their website, you can see that information there. But that is an additional tool that we have for those that test positive to hopefully get them early, get them infused, for which we do have capacity to do, and then ultimately keep them out of the hospital critically ill.
While you're up there, are there any DMAT teams at any LCMC official or facilities?
Our only team is the one that was discussed earlier at Children's.
And so that's all 24 are at Children's?
Yes.
Any other questions? Yes.
Michael, this is one I need to ask. September 24th, you guys are planning Tardy Gras. What are the plans for that at this time?
Yeah, so that really wasn't finalized. I mean, there was a lot of discussion about that. Obviously, we're not going to have a parade at the same conversation where we're talking about the hospitals bursting at the seams. So one of the difficulties with planning a parade, and look, we need a parade. I mean, you know, emotionally, I think we'd all want to be parading now, but that's just not where we're at, and that's just not the reality that we face. The difficulty with planning a parade is there's a lot of organizations that put a lot of money down. It's not something just a concert on the weekend. They get their membership dues, they have costumes, people buy beads, and they have to get the tractors and the floats. And I don't want to be canceling a parade, you know. I don't want them losing more money in a very tough time. So also some of the captains had said, the further we go out looking at a parade, it almost jeopardizes next year. I mean, people don't want to spend money to ride late in the year and then spend money to ride, you know, during Mardi Gras. So that's just not part of the discussion, you know. I don't know where we'll be at the end of September, but I think with the start of school and everybody getting back and the fact that the kids aren't vaccinated, it's a very tenuous time in our community, and we got a lot to try to balance that without having a big celebration that brings a lot of people together, puts people in cars, has a lot of private parties. It's just, honestly, it's just not an appropriate time to be planning a parade. I wish it was different, but that's where we are. Yeah.
The first year of COVID, the state opened up the convention center for more bed space. Today, up here, a lot of people have been saying we're running out of space. How close are we to going to the state and saying we need this facility
I'm going to let one of the medical professionals answer that, but I am hearing, you know, in the conversations, it's not so much a lack of space, it's a lack of staff. Is that correct? But if anybody wants to answer that from your hospital system, are they looking at flexing out to other locations?
You know, so that's something that we've been in conversations with the state with all along. You know, I think initially during that first surge, the issue was space. And so specifically for the convention center, it was getting people out of the hospitals that, you know, didn't really need that highest acute level of care, but yet couldn't go home yet, whether they were still on oxygen or had some basic needs. It's really shifted now to where we're better at getting some of those people out, but it's really a staffing issue. So it's less a space issue and a physical bed, it's more of a staffing issue, which we also have been in discussions with the state with and the federal government. That's why these DMAT teams have been deployed across the state. And we also have some other contracts that we're looking at with the state specifically for staffing that would help in the hospitals. So instead of moving people out to a different location, we would bring in staff to actually help with that. Unfortunately, across the country, staffing is tight. And that's the problem that we're having now, is actually getting those medical professionals that are available to do that work.
Dr. Elder, do you have an idea how many people are out, hospital employees are out within LCMC?
We have roughly a little bit under 200 that are out ill currently.
A quick question for Dr. Sanders. You gave the timeline of deaths between January and August. All those deaths that you called out, were all those COVID related?
Yes, those numbers I gave were all COVID deaths, not died with COVID. Those are people that died from COVID. Yes, sir.
Dr. Klein, you referenced, do you have an idea of the total amount of children at Children's Hospital?
The number of children admitted on any given day varies a little bit, of course. Right now, there are about 18 in the hospital in total. We had been dealing for a couple of months, as you probably know, with an epidemic of another virus, RSV, a very unusual summertime epidemic. And so that really had us full. We were stretched very thin by RSV alone, so COVID has sort of landed on top of that. Fortunately, RSV at this point seems to have abated some. But yes, the number in hospital on any given day ranges from about 15 to 20, and ordinarily 5 or 6 of those are going to be in the intensive care unit and either on a ventilator or receiving some other kind of critical care support.
Any other questions? Okay. All right. Thank you so much for being here. We want to remind everyone to go to covid.jeffparish.net to get the latest information on testing and vaccine sites. Thank you so much.